Welcome to the Heart of Healthcare podcast. Hello, listeners, and welcome back to the show. Today, I'm with Hemant Taneja, the CEO of General Catalyst, one of the largest and most influential firms in technology and healthcare. Over the last decade, Hemant has become a leading voice in how innovation can and should reshape systems for good. He's backed a ton of healthcare companies, including City Block Health, Devoted, Sesame, Transcarent, Row, and many more. In his new book, The Transformation Principles, he explores what it really takes to build enduring, mission-driven companies in sectors like healthcare. I just read it last weekend. It's fantastic. Hemant, thanks for being here.
Thanks for having me.
You came into healthcare through the lens of technology and systems change, not necessarily the traditional healthcare medicine route. What was that moment that you realized healthcare was like that next frontier that you wanted to tackle?
Well, first of all, I came into healthcare with complete serendipity. What happened was this was 20 years ago when I got a call from Partners Healthcare. I was in Boston at that time. And they asked me if I would want to look at this data set they've been building around electronic medical records. And my first question was, what's an electronic medical record? So that tells you you literally knew nothing about it. And sort of train of thought led to the creation of a company called Humedica, which eventually got acquired into Optum Analytics. And then that's where I had met Glenn. Glenn was running Allscripts and he invested in Humedica with us. So then he and I decided, and Lee decided to start Livongo in like 2012, 2013. Once that started working, the confidence grew that we sort of understood the limitations of technology. I'd seen some of that at Humedica. And we also understood the power of creating a true culture that was at the intersection of technology and healthcare at the ground floor, and that we could build great experiences for consumers. It just felt like we figured something out. We should lean into it. And, here we are sort of a dozen years after that.
Now you're a healthcare person. When I came to healthcare from Boston as well, without a background in healthcare as well, I got a ton of pushback. And I met a lot of what I call the COG or the cranky old guard. And these were folks that were just so stuck in their ways and not open to the possibility of doing healthcare in new ways. Did you face any of that?
The good news is I am the COG. So maybe I didn't face much resistance there. No, I think we always took it with the lens of building technology companies, just intuitively focusing on bending the cost of healthcare and sort of the principles that eventually became health assurance. I think it led to an interesting value creation path. And I think in our team, the confidence grew because Livongo ended up becoming a great outcome. Then I started Commure in 2016, 2017 with a couple of friends, and that started working. So I think there was also if this industry needs a lot of help. We've clearly figured something out. It was hard to articulate what that was. We figured something out and we really should go lean into it and make a difference. And obviously in 2020 when COVID happened and I was publishing my book, talk about having a prepared mind and a black swan moment to go execute that against. It just, sometimes things happen for a reason.
What's one idea or assumption about healthcare that you've changed your mind about over the last 10, 20 years?
Look, in technology companies, you always look at how's the revenue growing and the unit economics, and that's generally very good because the reality is it's a rational market that you're selling software into in most cases, and it's growing because customers are making rational decisions and deriving a lot of value. You can make that leap. A lot of revenue growing in healthcare has no correlation with you're actually doing good to the world. So I just don't pay attention to that as much in the early days. And I very much focus on how is the system truly being impacted by this company. And I've resisted just chasing companies that can grow revenue very fast. Now we have really fast growing companies, but if you look at a lot of them, there's a sense of purpose to them on what they're also trying to impact in the system. And that's been a true north for me in everything I have tried to do.
I feel like revenue is such a leading KPI for most investors. So what is it that you're looking for in the early stages?
Well, look, I think, you want to see that it's a business that's going to be large, it's going to have good margins, but everything meaningful that you'll do in healthcare will just have that. So I just think it's almost like an outcome as opposed to that's the input. So my pillars of health assurance very much have been, is this something that's going to move us towards proactive care? Is this something that's going to move us towards affordability and accessibility? We're talking about City Block, for example. I mean, that's very much focused on that with their community care model, or Homeward, same idea. And so we've tried to focus on those principles and test against that rather than can you build $1 billion of revenue. I think you can sneeze and get to $1 billion of revenue in healthcare. It's just not interesting.
It's too big of a market not to. You've
Exactly.
said that capitalism needs to be more responsible. Do you think that you can convince other VCs of that? Because I don't know, in a lot of ways, like they view their core job as just simply generating return for their LPs and thus themselves, and it's kind of just how the market works. So I'm just
They're not
curious
wrong.
your take
They're,
on,
they're
yeah.
not wrong. So I think the journey I'm on and we're on is to prove that this is the way to create the best returns. We're going to keep, working towards can we create a really high performance investment business that also simultaneously has the greatest impact. And is there a flywheel of profit and purpose that makes our companies and our own business more successful as a result of that? I think that's the journey we're on. And I deeply believe it. A lot of the people that at our GC are here because they believe it. And no one should follow us if we can't actually demonstrate that. So I don't begrudge people for having the traditional view because that's worked for the industry. I just think if our companies are building with the intention that I described, for example, in healthcare, that they'll be the most successful. And if that's the case, then others will follow. And that's the only case in which they should follow.
And in your book, you contend that profit only capitalism, which is what you kind of call that chasing shareholder value only, has run its course and will now do more damage than good. And curious why is the current global context made capitalism unsustainable?
Well, take the example of healthcare itself. If the goal was to keep adding costs to the system, that actually makes the whole system untenable. I mean, 50% of
Yeah,
budgets in most states are Medicare, Medicaid. So what are those governors supposed to do in terms of education and other places if this is going to keep ballooning?
crowds it out.
As an example, right? Where
Yeah.
natural tendency of capitalism would be like, just go figure that out without really systemically making it better and shrinking the GDP of healthcare, if you will. Another thing is, I think if you look in the world of AI, the market forces are such that you could take a lot of the work that gets done in society and the business that gets conducted in society and suck it into a handful of companies. What world, and that's natural market forces will take you there. In what world is that a sustainable and
Yeah.
situation? So you need resiliency where there is inclusive prosperity. Every region is benefiting from AI and creating jobs and capturing their productivity gains that are coming at the expense of labor, as opposed to it all goes into just a handful of companies. So I do think this transition in AI does require a lot of intentionality towards the ecosystems we're going to create on the other side of it.
How much of this inefficiency in capitalism can be solved by founders versus like we need regulation to solve it? New policies, better policy.
I'm not a fan of regulation per se. One of the books I had written was on intended consequences, which was very much about the builders taking responsibility and focusing on the inputs into building the next generation of companies. Because I think startups are the most important institutions in some ways in this era. And if they have the right mindset and mechanisms in how they want to bring about goods and services into the world, and that's much better than regulation. That's much better than things like ESG, which are bolt-ons that are gamified behaviors. And that's much better than, creating an environment where innovation can't really thrive. Regulation can stop it. I think you've seen that in some parts of the world where you don't see the most innovative companies because the administrations tend to overregulate. And so, but there's trust, there's collaboration between technology and policy. There's a set of principles with which we're building these companies and focus on the right inputs. I think we can get most of the way there. I'm not saying regulation is not
Yeah.
necessary, but I do think founders can take us most of the way there if they build intentionally.
On the payment side of healthcare, obviously, we're dealing with a lot of unsustainable costs out of our pockets as premiums, out of pocket costs, Medicaid coverage shrinking. How can innovators support new payment models so that everybody can afford preventive healthcare?
Yeah, look, first of all, the thing it sort of says is that Commure a lot that the work tax in healthcare is just incredible. Like if you, when we started Commure, I was very inspired by Stripe, which was increasing the GDP of the internet. 3% of revenues go to credit cards. How do you really sort of work off of that and turn that sort of margin into all the software that these businesses need to run? And in healthcare, I was like, well, let's learn from that and think about reducing the GDP of healthcare and creating software that eliminates a lot of the inefficiency. It costs us 15 cents on a dollar to process payments, right? I mean, that's not what it's in e-commerce, but in healthcare it is. And how do we really compress that? And if you could turn that to 3% someday with AI and a lot of the tools that are getting built, what do you do with that extra operating margin. That's what you can invest back in the communities. That's what you can invest in preemptive care, because we need a way to fund preemptive care and finance it.
Yeah.
And because we don't think long term, because unless every insurance company did it at the same time, no insurance company is going to
No.
do it because there's leakage. There's sort of a game theory problem there.
Yeah.
How are we going to get there? We need to open up the resources to invest in that.
Yeah. Yeah, I mean, enrollment is on an annual basis. So why would a health plan have an incentive to invest in your health beyond the any benefit it can reap within 12 months? Beyond that, it doesn't make sense. Yeah. So you took what you call the outrageous step for a VC firm of buying a health system in my hometown in Northeast Ohio called Summa Health. What does a VC firm do with a hospital?
Well, I think the way I would like you to think about um, that decision was not because hospitals are great investments. I don't think I need to tell you that. Hospitals are very difficult.
I hear bad margins.
Exactly. Falling knives. That's what I was told. In fact, that's why we didn't buy it in our funds, because we wouldn't do that. We actually bought it in our own balance sheet. It's the mission and sort of the desire to take a risk to do something about it is why we did it. And think about the opportunity our founders now have. And I'm working with 6 of them right now in designing what sort of a cohesive stack's going to look like that can take a shot at helping this system run with high margins like some of the for-profits do, using AI effectively, taking the burden off of the workforce that is so strapped, figure out how to serve more people in the communities, bring in innovation. And it's this incredible collaboration around a lot of these companies, and our portfolio companies are then working with Percepta, which is our AI transformation company that's mapping it all out on the backs of these portfolio companies. So that's an enormous unfair advantage for our companies that are working with us. So that's
Customer
one way to
number
look at
one
it. Yeah.
right
So
there.
it's good for our companies. It's good for society if we take a shot at it and make it work. And we're being responsible and taking the risk ourselves on the asset itself, and not really putting our LPs at risk. So try to create conditions where everybody wins, and the risk is on us. And I just don't think you do anything great unless you are willing to take risk. And if you have a better way to do it, tell me, I'll go do that.
It sounds like the goal isn't necessarily more beds and expanding that, but using this kind of as a hub where the software can be validated and then the software is expanded nationally, but not necessarily just keeping it within the Summa Health world.
Yeah, look, we're not developing new technology. Our companies are developing those technology. We're just putting it together.
Yeah.
And if we can demonstrate it as a model, then others will follow as well. I mean, it's already happening. We already have various health systems that are closely watching this, have confidence in our companies. If you look at companies like, Commure, Hippocratic, you said CityBlock, AI Doc, many others that are working actively, Transparent, these are all companies working with us and helping
Yeah.
us through what we're going to do. If that orchestration of these companies together can systemically drive that change, then I think then we have a playbook. And then we have 5,000 hospitals to go do this to. That's the way I sort of think about it. And, it's not going to be easy and it's not going to be quick, but I think it's worth the impact we can have with it.
Are the founders actually going to Akron,
Of course.
spending time there?
Yeah. Yeah. And days at a time.
Yeah. When it came out, I think I shared, on social that, I, for one, was excited to see my hometown, which is largely ignored in the innovation ecosystem, finally become like ground zero for innovation and the opportunity there. I heard you distance yourself from private equity and saying this is not a private equity takeover of a hospital. Obviously, private equity is quite controversial within healthcare, but I'm just curious why you really wanted to distance yourself from it looking like a private equity takeover.
Well, first of all, because we're not doing it out of a private equity or a venture capital
Yeah.
fund. So that's just, it's literally not that. The second is, I think private equity playbook, which does have good financial impact on businesses, obviously, that's why this has a class is so large, is very much about financial drivers um, being the reasons why you offer the goods and services or not offer them. And when you're talking about a societal good like healthcare, that can't be the only driver. So you have to think about, okay, making sure everybody affordability and accessibility, in addition to proactive care, are actually met. So there's trade-offs in how you go about doing that. And that's why hospitals aren't the most profitable businesses on the planet as well. I mean, there's some of these are considered choices. And so you just can't bring that financial optimization mindset. But you also can't bring, by the way, one of the reasons nonprofits, hospitals aren't often so well run is because there's an aversion to profit. I think if you're getting profit, then you're not doing right by people. And that's also incorrect. So I think part of what we want to try to do is to say, look, there is a flywheel of profit and purpose, and you need to embrace financial rigor in how you run a business. But then you also make the choices in the way that you're serving everybody in the region where you are and effectively, empathetically, proactively. And so that just needs a new model. And that's why it doesn't fit in any bucket. It doesn't fit in the private equity bucket that cares about profit or the nonprofit bucket that cares about mission. We're trying to say, can we create conditions where you can actually embrace both?
Hospitals have notoriously been the hardest customer for software companies to sell into, yet with AI, that has completely changed. And a few weeks ago, Menlo Ventures put out a report that showed that hospitals were adopting AI faster than any other stakeholder in healthcare, faster than pharma, faster than health plans. It was shocking to see. Since you're close to a lot of these stakeholders,
It's not
what?
shocking. I mean, I've thought a lot about it. In
Yeah.
fact, November 2022, and I've gone and said this in a lot of talks I've given as well. When ChatGPT happened, we looked at every industry saying, where should we go focus? And I, as a person deep in healthcare, I was like, well, not healthcare, because people are going to be um, worried about safety of people. And we got a lot of calls from hospital systems. This is what led to Manjal and I teaming up and launching Hippocratic. We built a language model and sort of launched it, and it just started working deeply. And then at Commure, I was watching the Scribe solution being pervasive. They're launching small businesses, very large systems across the board, and it's just really scaling rapidly. And I'm also seeing with the AI doc, with the diagnostics, that was accelerating. I was like, what's happening?
Yeah.
And my conclusion was, in every other industry, when you bring in the idea of AI, and we're doing a lot of AI transformation work with our company Perceptine across the industries, the employees kind of resist it because they don't know what it means for their jobs. And so there's a lot of inertia in the middle. And unless there was a CEO who's really pushing it top down or a top leadership really taking ownership, it actually diffusion doesn't happen. Healthcare is different for the simple reason that every single person in the hospital is so burnt out from COVID that they need the leverage, they need the help. And so they're embracing it, saying, I don't care about what it means long term. I need leverage today. I'm drowning. And we're not taking care of the patients as much as we need to be able to. And how do we do that? So it's been, I do think healthcare has been the fastest, and I think it gives it the opportunity to do some of the transformation work. Like I feel really lucky because we really leaned in deeply because of COVID, which blew up the system. And then we got afforded this technology that also was a solution to
Yeah.
that system, all in the span of 2 years. And I
That
was
would have
like,
taken a decade at least
so like
otherwise.
we have to lean into
Yeah.
it.
You talk about building companies that matter for generations, yet, the average successful healthcare company sells within a decade. And then most founders have to give up control. What is your advice for founders, including, when Glenn Tolman sold Livongo and it kind of, was put under Teladoc, and that's a whole other story. But how do you tell founders these are their babies? And obviously, when you take VC money, you're building to exit, but you also want to build something that does have a legacy and does matter for generations.
Well, I think when you start a project, you're building to endure, not exit. I genuinely think if you believe in the power law, if you believe in founders being really mission driven that actually win, you want to leave companies that outlast you. So it's like in my book, I say the business must have a soul. The whole idea is it's going to outlast the founders and be generational. And now some ideas aren't there. The world doesn't cooperate. So
Yeah.
financially you'll exit along the way, but the mindset should always be to go all the way. And I wrote this when I wrote on healthcare, I mentioned in there that we need to create a dozen new platforms that are enduring institutions, or this dynamic is not going to change because the only companies that can afford any innovation in healthcare is the insurance companies. So you build something and that's your exit.
And
We spoke to
Amazon.
Medica to Optum, that's what United. And so it's an Amazon, you know what I'm saying broadly.
Yeah.
And so we need a market structure that's more balanced and that's more market oriented. And so I just don't think it's going to happen until we get there. And if you take a look at the work we're doing, and some of the companies I have helped start, some
Yeah.
of the companies really leaned into, because we think those have a shot at being these sort of defining institutions and create a more market behavior in the industry. Because if you don't have that, and insurance companies are the only ones that are large and have scale, it tips the dynamic and it makes it hard to create sort of real market force, market based sort of behavior in this industry.
Yeah. If you're advising a founder whose company is being kind of courted by a strategic buyer, let's say a health plan, what do you tell them to kind of watch for beyond the term sheet, but like in the integration, the mission alignment, et cetera?
I think it would probably be my generic advice around, are you going to have the autonomy to be able to do this? Is your core mission aligned with what the
Yeah.
acquirer wants to do? Because a lot of times that's not the case. Innovation sometimes goes to die in some of these places too. So I would look for that alignment so you can continue your work. And by the way, like, I'm not saying this as the people in insurance companies are bad people. Actually, very good friends with many of them, and they do this because they deeply care about people and are mission driven. That's why you go into healthcare on either side. But it's just the system is the way the system is a system, and I think until we really transform that, we're going to keep having these issues because market behaviors are going to be determined by how we've architected it.
Yeah. I mean, M&A is challenging for any company in any industry, and it does feel like M&A in healthcare is especially challenging. What about the public markets? Do you think that they are built to reward the kind of long-term system changing work that you believe healthcare requires?
So, when we sold when we took Livongo public, Morgan Stanley was the lead bankers, and it was Paul Kwan, who's now my partner here at GC. And I was very keen on, this is a SaaS company. Look at the numbers, look at the NDRs, look at the gross margins. Everything is a SaaS company. You got to have the market treated as that way. And so we had to carefully build a book of investors that got tech and wasn't just purely that got healthcare. And
Yeah.
then when the market corrected into 2022, my first advice that January to founders was, those days where you're going to get these tech multiples for service companies are largely gone. And so you just have to have the task of building companies with real ROI that are 3 to 4 or 5 times bigger than SaaS companies to get those kinds of outcomes. You just got to sort of expand your ambition, how you think about the scale of it, provided it's aligned with our principles of actually bending the overall cost. And that's the guidance I've been generally giving to a lot of the founders we work with, because healthcare is different. And I also think if we just took all the technology gains in delivering healthcare and just kept it in a handful of companies and
Mm.
don't pass it on to society, then we have other issues. So it's also interesting in that way, because we need to pass margin back to make the system be more resilient as well. So I think it's a complicated dynamic overall.
So I want to spend the rest of our time doing kind of like a rapid fire. You can give me quick answers on these. Boston versus San Francisco for founders.
Can I give you a long answer on this? Because when I was in Boston, I worked on this for 10 years, saying we have such smart people here. That's where Zuckerberg was. That's where John and Patrick were. That's where Drew Houston was. Boston originates, but doesn't retain them. In fact, when I moved to the Bay Area, one of the investors, they asked me what happened to Boston, because in the 90s, they were very vibrant. And I was like, well, Boston ran out of second-time entrepreneurs because it got so easy to keep backing these folks that were building these God boxes and quick IPOs in the late 90s, that the VCs that got trained to just not pay attention to first timers. And culturally, that led to all the ecosystems being built in the valley. And now there's a flywheel effect where it's hard
Yeah.
to really unwind that. So that's what happened
Yeah.
in Boston.
I experienced that when I started Rock Health. We were living in Boston. I was at Harvard Business School, and the VCs in Boston weren't interested. I went to San Francisco, and they were all super excited. NEA, Excel, they all backed us. I was like, well, this is where we need to be. All right,
Exactly.
question 2. If you could redesign one regulation in U.S. healthcare system tomorrow, what would it be?
Interrupt.
You've spent years bridging tech and healthcare culturally. What do you think each side misunderstands about the other?
The tech people don't get that healthcare is not a free market, and they think they write a good piece of code and everybody will just embrace it. And the healthcare folks are so viscerally struggling with the dynamics of the existing system that they don't have the ability to think with the first principles about how to change it. So no one really understands healthcare deeply inside the healthcare system because they're all so siloed in their worlds.
When will AI replace doctors?
Yeah, it's a continuum, but most of what doctors do in the next decade, I don't see why AI can't do most, not all, but I do think most of it. You're already seeing lots of the workloads that physicians do. AI can do pretty well.
Or better?
Seeing, yeah,
Yeah.
doesn't get tired, doesn't judge you, doesn't make
I'm
mistakes, current on all the publications. There's just advantages that you have in that non-bionic system.
There's a meta-analysis showing that patients rated messages written by AI as more empathetic than
Well, I've
those written
listened
by
to phone
doctors.
calls from Hippocratic. I've listened to
Yeah.
phone calls, and it's mind-blowing. I've listened to all these elderly, they would say at the end of the call, "I know you're an AI, but I like you." And then when the next time that same AI calls, memory of the conversation,
They're like,
it's
"Hi."
yeah,
That's funny.
it's a relationship.
Are we in an AI bubble?
Bubbles are good. They
Why are
organize
bubbles good?
capital yeah, because they organize capital and talent into important problems. Some stuff doesn't work, but then you also create
Yeah.
institutions that shape society for a long time. And I do think some of that is happening today. How can you not? We have 50% of the country's growth in US is in AI because of AI investments. It's like a venture capital bet on AI as a nation. And some of that stuff is, I think, really difficult to see how it's going to play out. And some of that stuff is going to be phenomenal. But, is it going to create abundance and resilience in society? I really do think it's going to. I'm very optimistic about what it's going to be. And it's a really hard time to be an investor because you don't know what's going to be durable versus not. But these are the moments we live for.
All right, my last question. If you weren't a VC, if you weren't in your current job, what would you be doing?
Well, if I was in a VC or building, I'd be teaching because that was my goal out of grad school.
Love it. All right, Hemant, thank you so much for being here today.
Great. Thanks for having me.